How you doing, sir? What's your name?
Dr. Burgess.
What is it?
Dr. Burgess.
Dr. Burgess. How you doing, Dr. Burgess? What brings you to a boxing event?
I've always been a boxing fan. I actually boxed as an amateur myself, and it was a Golden Ball.
Oh, okay.
I've always had a passion. I was a Golden Glove myself.
Oh, yeah, me too. What weight you fight at?
I was welterweight.
Welterweight, okay.
47.
Yeah, I was 139, 140.
I was the tri-state, New Jersey, New York, and Connecticut.
Oh, those are tough guys.
Those were very tough guys.
Guys, yeah. So, and then you were boxing as a young teenager, I suppose?
Yes, sir.
And then how did you become a doctor?
Well, I decided that I wasn't going to be the best, so I'd give a crack at medicine.
So it was better to use your brain than get your brain knocked in, I guess.
I think so. But I love the sport.
Yeah. So what are you volunteering your time now?
I volunteer as well as do regular work as a doctor here.
So now what do you look for when you're watching these young guys? Is there something specific that you're watching?
Stability, fatigue, those types of things. Sometimes a fighter will tell you when they want to get out of the fight. And other times the fighter just won't quit. So you have to know when to step in and when to realize the fighter needs to go out. Those are the things we look for.
So you have the discretion to jump in there at any point in time you feel it's necessary?
Usually we'll wait for the referee to tell us, but we have an agreement.
Fair enough. What's the most brutal thing you've seen watching as a doctor, live?
Well, unfortunately, watching fighters you're talking about?
Yeah.
Well, unfortunately, I was involved in one fight where the person was hit so hard he died.
That's tough.
Intracranial hemorrhage, chronic head injury, what we call chronic head syndrome, what we've seen in the professional greats like Muhammad Ali and Holmes. Those are the things that we would be concerned about.
Was that an amateur or a pro fight?
That was a pro fight, professional fight.
Now, would you say it's more dangerous of something like that happening or not? Like, what side is it? Is it a 50-50? Is it?
I'm less concerned it'll happen. It usually happens with when fighters don't know when to quit and they take too many standing 8 counts. That itself has become a controversy in the sport. I researched and found out that there's a lot more fighters passing away from boxing than we know about, right? I do agree with that, and I think what we see is a lot of chronic encephalopathy, which means they get hit so many times that they start to have damage to the brain.
So you're ringside, you're watching, someone gets hit, they wobble. What is your perspective on that? What do you do? What is your reaction?
I think we have to be more aggressive in stopping a fight, especially with professionals. They can take a lot of punishment and take a lot of injury to the brain and keep on going. I've seen some of them stay on their feet and they're unconscious and still fighting.
Well, there's a lot of controversy going on too because some referees stop it too premature. But it's better. I guess what you're saying is better to be safe than sorry.
It's much better to be safe than sorry. I mean, if you stop a fight too quickly, the fighter has another chance. If you stop it too late, the game is over.
Sure. So what motivation or inspiration would you give any young fighter or pro fighter or even a coach at that matter for boxing?
Dedication to the gym is everything. The more you work out, the more you practice at the gym, the better you're going to be. This is a sport where fatigue and repetition is necessary.
So someone that trains very, very hard, they're running 5, 6, 7 miles for maybe 6, 8 weeks straight. They're doing everything they got to do, but they still get tired. Is there a reason for that?
Well, we have to look at the reasons for those. Sometimes we'll see underlying cardiomyopathy and heart disease, and we have to be very aware of that in young athletes.
Now they have pre-fight examinations they have to go through, etc. Do you think it's more than not they should be a little more diligent in those pre-exams?
That's a very controversial area because there's so many that'll be normal to pick up a few, and we have to look at how much we want to
spend on those types of things for the fighters when we're looking at a rarity as opposed to a common thing. I mean, the proper evaluation would be EKG and cardiac echo, but do we do that on every young fighter coming? We'll be doing a whole bunch of them if we did that, and a whole bunch of negative ones.
True. Okay, so where can anyone find you at?
I'm sorry?
Where can anyone find you at that's going to watch this video? Where can do you have a social media? Do you have your own office? Where you from, etc.?
Doc Burgess at America Surgery Centers.
And that's in Massachusetts?
Massachusetts.
Doc Ferguson, Massachusetts. Well, good to meet you, sir.
Same here.
Josh Beaman.
Thank you so much. It was a pleasure, gentlemen.
Thank you.